How much stress do you endure on a daily basis? And if you do have stress, how long have you been stressed out? Whether you're 20 years of age or 80 years of age, stress will eventually destroy your mood, your memory, your immune system, and a whole host of other things in your body. What you may not be aware of, though, is the fact that you're a man affects the way your body responds to stress. And there are some very important relationships between your manlyhood and your chronic stress that will make or break you as you live life and try to maintain your health. My name is Dr. Lena Edwards, and I am a certified stress medicine expert here to teach you some very important information. All of us stress out about different things, but men tend to stress out about things that are different than the things that women tend to stress out about. Men in particular tend to worry over things like finances and their jobs, their family relationships, especially that with their spouse. Lots of different things that affect us differently will affect our stress response, and this is specifically important in men whose stress response differs. Men tend to respond to stress also very differently from women in their behavior, meaning that they tend to be more isolated and tend not to discuss how they feel and how stress affects them as much as women do. But in addition to the typical types of stress you think of primarily that are psychological, there are lots of other stressors in our environment, some of which we expose ourselves to because of our stress. One of the things that we have a little bit less control over are the environmental pollutants and toxins, things in our gasoline, our water, radiation exposure. Some of us may even take prescription medications, and even those are considered stressful to the body. What we eat is also a stress. And sometimes when you're stressed out, you're more likely to eat unhealthy food, drink more alcohol, smoke more cigarettes, or use other types of drugs as a way to manage your stress. What you may not realize is that there are actually factors that are completely outside of your control that affect the way that your body makes cortisol and the way that you respond to stress. These things include your age. You're much less likely to be able to stand the effects of stress the older you get. Some of you are hereditarily predisposed to having an abnormal stress response. If you've been abused or exposed to other types of stress, especially when you were a child or young, that has permanent and long-lasting effects on how you make cortisol and how you respond to stress. Are you a type A person versus a type B person? That makes a difference. Even the characteristics of the stressor, especially if you have a stressful situation that you have no control over, that has control over your stress response. But probably one of the most important things that determines how and when you make cortisol and how well your body is going to stand up to the effects of chronic stress is your gender. In fact, the fact that you're a man completely changes the way that your body makes cortisol, the way that you respond to stress, what kind of health effects chronic stress is going to have on you, and even how well your sexual function and testosterone hormone levels are going to hold out for the duration. But before I get into the specifics of how chronic stress affects you as a man, let me just talk about why chronic stress is so dangerous to begin with. It has a lot to do with the hormone called cortisol. And many of you know cortisol as the hormone that is the primary fight or flight hormone the body makes. It's the hormone that helps us to survive in situations where we're either forced to fight an enemy or to flee a situation. By design, Mother Nature created this kind of stress response to be short. So the bottom line is that cortisol is an extremely important hormone for our survival in the short term. But when you've got elevated cortisol levels chronically, whether it's from your job or something else, then the very hormone is designed to protect you from the harmful effects of eventual death actually become your worst enemy. So how does being chronically stressed make a man feel? Well, first of all, chronic stress can cause chronic fatigue. It can affect your performance at the gym. It can affect your performance in bed. It can make you gain belly fat and weight other places. It can actually make your breasts get bigger and your testicles get smaller, and it affects your mood. Not only does chronic cortisol elevation cause these things, but too much cortisol for a long period of time is also going to lower your testosterone levels. And we all know how important testosterone also is for things like your memory, your mood, muscle tone, muscle mass, sex drive, and numerous other things. Keep in mind that this will happen regardless of how old you are. So even if you're 25, if you've got chronic stress, you may feel more like you're 65 simply because of what cortisol is doing to all of your systems in your body and specifically to your testosterone levels. It may interest you to know, actually, that there's a very important relationship between cortisol and testosterone. So not only does your cortisol lower your testosterone, but testosterone plays a very important role in keeping cortisol levels under control. So for instance, if you're an aging man whose testosterone levels are gradually and normally decreasing, you can expect to have higher cortisol levels and all of the adverse health effects thereof. But even if you're a younger man who should have normal testosterone production, but you don't, either because you're overtraining or because you've got sleep apnea, as just two examples, then you can still expect to have abnormally low testosterone, not because your testes can't make it, but because of other conditions that are reducing your ability to make testosterone. And once your testosterone's low, your cortisol will go up. So because of these really important relationships between cortisol and testosterone, in comparison to women, men tend to have higher cortisol responses to acute stress. They have less tolerance to changes in their sleep-wake cycle, and they have more stress-induced heart disease, high blood pressure, diabetes, and stroke. These are very real facts, but the good news is there are things that you can do proactively before you get to that point. Now, these things may seem pretty obvious. Things like getting enough sleep, eating a healthy diet, reducing your exposure to environmental toxins, maintaining a healthy weight, avoiding things like alcohol and nicotine that have been shown to make the stress response system very abnormal, practicing stress reduction techniques. Even exercise, though. Moderate exercise is good, but you may not know that if you over-exercise or overtrain, that actually damages your stress response. Now, some of you may already be doing one or more of these things, but if you have a hormonal imbalance, such as too much cortisol or too little testosterone, you may have a difficult time getting enough sleep, or you may be having a difficult time eating a healthy diet because you have cravings that you can't control, or maybe you handle your stress by smoking or drinking alcohol. So when these things alone aren't enough, then there are some other natural-based options that you can add to this regimen to improve the likelihood of these things working and to help guarantee success, even if these things are helping but not completely. I would like to introduce you to AdrenaMen, a supplement that I have developed after 20 years of working with men who are chronically stressed and men who have hormone imbalances related to chronic stress, or in men who have abnormally elevated cortisol levels because of abnormal male hormone levels, including testosterone. In spending nearly 20 years taking care of male patients with these issues, I became very frustrated, as did my patients, because there was nothing available to them that they could use as an adjunct to all of the lifestyle changes that they were already making that helped their body's stress and sex hormones improve and maintain under conditions of chronic stress. And it was purely out of the need for such a supplement that I developed AdrenaMen. This supplement is unique in that it is the only one available that has been specifically formulated for men and contains ingredients that specifically help to improve the male's stress response and also male testosterone levels naturally without necessarily needing to use supplemental testosterone therapy. The vitamin combination that I chose for this supplement includes vitamins that are specifically designed to help improve the stress response, maintain adrenal health, maintain healthy testosterone levels, and healthy cortisol levels. Under the proprietary blend, the first several items are known as plant adaptogens. And adaptogens have been shown to improve the body's resilience to stress. And during periods of stress, and chronic stress in particular, they help to promote the survival of your cells and reduce DNA damage and free radical formation. In so doing, adaptogenic herbs have been shown to help improve immune system function. They serve as antiviral and antibacterial agents. Some have actually been shown to protect the brain and the heart during periods of chronic stress. Symptom-wise, they help improve things like mental function, stamina, endurance, and some of the items in the proprietary blend are specifically unique in that they help promote male sexual health, sperm count and sperm quality, as well as overall sense of male well-being. There are several other plant-based items such as saw palmetto and stinging nettle. Those have been specifically designed to improve prostate health so that in general, this supplement is going to help maintain and support healthy male prostate and urologic health, cortisol levels, and testosterone levels. So, is AdrenaMen right for you, and are you a candidate to try it? Well, if you're a man who's experiencing hormone imbalances related to stress, whether that's cortisol or testosterone or other male hormone levels, then you may want to consider adding the supplement to your regimen. If you're experiencing low male hormone levels due to intense exercise or overtraining syndrome, this is a supplement you would want to give strong consideration to adding. You may be a man who is already on testosterone replacement therapy and you're not deriving the full benefit, or perhaps you're on more testosterone than you need, and using this supplement may actually help reduce your need for testosterone, because testosterone does have some abnormal side effects you may not want to have, especially if you're on doses that are higher than what you need. The supplement should also be considered in men who maybe can't use testosterone replacement therapy, for instance in males who had prostate cancer. There is more extensive information about the dosing of AdrenaMen and whether or not you may be a candidate on our website, www.adrenalogics.com. So in summary, if you're a man who is suffering from any of the conditions listed on this slide, and you're already trying the other things that you need to be doing to try to get your stress and sex hormone levels under better control, AdrenaMen may be an important addition to your treatment regimen to try to make everything you're doing work better, and also to do things at the cellular level to help improve your cortisol levels, improve your body's ability to withstand stress, and also to improve your sex hormone levels and the effects of stress on those levels. So stress is all around, and I'm sure that those of you watching this educational video experience stress in some form on a daily basis. But now that you understand that stress affects you differently as a man, you can now think differently about how you're going to navigate your way through your stress and how you're going to get and keep your health. Now you have the information and the tools that you need to stay healthy, even though you're going to be subjected to chronic stress. And because you're a man and your stress response as a man is different, you now have the information that you need to take a proactive role in getting healthy and staying healthy. Thank you for your attention. I hope you have found the information helpful. This is Dr. Lena Edwards.